was picked up, was diagnosed, the appropriate lab tests were done, the appropriate imaging was done. She received appropriate treatment and is now recovering at home.
Health Canada says a Quebec woman who developed rare blood clots after receiving the AstraZeneca vaccine was over 55 and had no other risk factors. But Canada's health regulators say they're not changing their recommendations for the AstraZeneca vaccine at this time.
The risks of COVID far outstrip the risks of the vaccine at this particular time, that the safety surveillance network is indeed working, and that when we see reports of adverse outcomes, that means that everybody is doing their job. Everybody is watching for these adverse outcomes. Everybody is monitoring.
Health Canada is making some slight changes, adding more information to the vaccine label and issuing more guidance for healthcare providers on warning signs to watch for. However, Chief Medical Advisor Dr. Supriya Sharma says the risks of blood clots still remains very low, around 1 in 250,000. Health Canada says it's basing that on data from the United Kingdom, which Dr. Sharma says has the most complete post-immunization data available.
If you're a woman between the ages of 15 and 45, your risk of a blood clot is around 1 in 3,300. If you take a birth control pill, that goes to 1 in about 1,600. Some of that is just background rates, just the natural sort of incidence. If you are pregnant, it goes to 1 in 300. If you are right after your pregnancy, it goes to 1 in 100. If you are in hospital with COVID-19, your risk of having a serious clot is 1 in 5.
There's also questions surrounding the Johnson & Johnson vaccine. The U.S. pausing its use after 6 cases of rare blood clots out of 6.8 million doses administered. The J&J shot is approved in Canada, but no doses have arrived yet. Regulators say they wouldn't hesitate to press pause on the J&J vaccine if needed.
Health Canada is following this issue very closely and is working with the manufacturer, the U.S. FDA, the European Medicines Agencies, and other international regulators to examine it, and will take any action if necessary.
Now, Health Canada adds that if after receiving the vaccine you start to experience persistent headache, persistent abdominal or limb pain, or unusual bruising anywhere other than at the site of vaccination, you should seek medical attention. Though they add that even if you haven't received the vaccine and you're experiencing these persistent symptoms, you should still seek medical help. In Ottawa, Xiaoli Li, City News.